Joining us now is West Virginia Senator Joe Manchin. Thank you so much for joining us, Senator.
Thanks for having me, Lindsay. Appreciate it.
Wanted to start right out. Yesterday, President Trump was praising West Virginia, saying that the governor had done a good job because at that time you all did not have anyone who had tested positive for coronavirus in your state. What was your reaction when you heard that?
I just couldn't believe it because they should know the facts. We had very few people even tested, period. That's the reason. Up until that time, we only had 84 tests done out of 1,800,000 people. I've got people slamming my office as we speak right now, Lindsay, basically saying we need to be tested. We have symptoms. We can't get tests, but I will say this. Talked to Mike Pence last night. Vice President Pence is working, trying to get us the testing equipment and all the supplies. West Virginia should be a tier 1. We have the most vulnerable people. We have an elderly population, a sickly population because of all the hard work they've done with respiratory diseases. And we've got to make sure we're on the front end of this. If not, it'll be carnage. It'll be just a tsunami that'll hit us, and we're not prepared for it.
You still feel that you're not prepared at this point?
We're getting there. We're going to be getting there. We've done all the things. I praise the governor and people who did the right thing by basically shutting schools down, stopping social gatherings, all the things that we should be done that Dr. Anthony Fauci said that we should do, limiting our social access to people. And we're doing everything they've said. But from that, when you have a very fragile population, it's going to spread like wildfire if you're not on top of it. We don't know where we might have it. We don't know where maybe in parts of the state we could basically isolate that a little bit more. The more testing we do, the better we're able to control this horrific virus. And that's same for the whole country right now, but we just don't know.
When we talk about the whole country, the Senate has just passed phase 2 of the coronavirus stimulus measures. It calls for 2 weeks of paid sick leave and up to 12 weeks of paid family leave for many Americans, free testing, additional funding for unemployment insurance, and the expansion of food security programs like SNAP. Senator, is this enough?
Well, it's not enough, and we know it's not enough. That was the second tranche we said. With that being said, it basically does get free testing. It's going right to the medical end of it where we need to go. Lindsay, we need to find, first of all, the money we have on the first that we spend right now is for 2 purposes. First of all, to find any type of treatment that we think that if you contract this virus, how can we give you relief? How can we help you get better? Next of all, finding a workable vaccine. That's going to take a little bit longer. So when you're doing that, basically treating people that are affected and trying to find a vaccine, that's your first and foremost. Next of all, how about the people that had to go home and said, hey, we're going to close your businesses so you have no place to work? Those are the people on the front line. Sending me $1,000 is not going to help the economy. Sending you and all of us who have paychecks right now, sending the people that are getting social services is not going to help because it's not changing except their social interaction. What we need to do is be focusing on the people that have really been affected. That's the people on the small businesses, front lines, that are sent home with no hope whatsoever, and no unemployment compensation. We need to expand that, work off the existing programs, and we can keep this moving. Having long-term, basically, relief for businesses, small businesses, that can survive, that doesn't have the capital like large corporations. And making sure, Lindsay, large corporations, if they need loans, low-interest loans, basically, from the United States government, we can do that. I'm just not in favor of bailing out for the sake of bailing out people that got the greatest tax breaks in the world.
What message do you have, people, for living in states with low confirmed cases such as yours? Do you think that people in those states potentially have a false sense of the risk?
Sure, they get a false sense. When you see the President of the United States or the governor of the state of West Virginia saying, hey, if you want to go to Bob Evans, go ahead and eat, that's wrong. No, you should not. And if you see the president say, must be doing something right, we don't see anything in West Virginia, so we'll make you a tier 2. Tier 2 means we're not on the high priority list. I called last night and said, let me tell you one thing. When it hits my state, it'll be more than tier 1, I can assure you. And I want to prevent that from happening. These people work too hard. They're too darn good to be left and felt like, well, we'll wait to see whatever happens. If something happens, we'll be there. That's too late. So hopefully we'll be moved up to tier 1. That means we're going to have the supplies we need. We'll have the testing and also the rapid response. Right now it's taking 5 to 7 days if you do get tested in West Virginia before you know. One guy came to me and said, Joe, if I'm as sick as I am 7 days from now, I might be dead. So they're concerned. So we're doing everything we can to bring the alertness to the federal government that we need you in West Virginia, making sure the most vulnerable people in America aren't left behind. And it's not too late for them.
And you mentioned the elderly population there. 20% of your state is over the age of 65 years old. How will you handle this particular high-risk group?
Well, that's the thing. I've said this. One thing about our state is that we do try to look out for each other, and we take care of our neighbors. If you have an elderly person living with you, a relative, or if you have an elderly neighbor, try to do some shopping for them. Try to help them so they have the necessities that they need to sustain themselves. Don't have them going out in stores and going out in public if they don't need to right now. If we can all be a little bit disciplined for the next 2 to 3 weeks to see where this curve is going to go, if we can get a handle on it. Right now, it continues to grow. More people are getting this disease in America, and we're going to see more deaths from it. And we want to prevent that. And you can only do it by being disciplined. But you got to help your neighbors, help your families that are elderly. Anyone that has illnesses, help them. That's the most important thing we can do.
City dwellers are getting a lot of attention and resources, but there are also special risks to rural populations, of course, where hospitals might be more spread out, for example. Is your state getting the resources that it needs? You said that you had talked to the vice president, for example, last night. Do you even have enough tests? Will you have enough tests?
We don't have enough. We only had 500 tests for the whole entire state of West Virginia. Can you believe that? 500 is all we had. As I'm speaking to you now, they're supposed to be getting more to us immediately. We have very few respirators or ventilators that would help people, and we have a lot of respiratory problems because people worked in heavy industry. So we know we have all of that hitting us on top of a pandemic and a virus that attacks basically the lungs and all the things that we know that basically are very vulnerable to in my state. So we're very concerned about that. And I'm hoping they come to, we'll see, I'm hoping they come to our rescue to give us what we need. We had hospitals that were closing. And I've said, wait a minute, not one hospital that was planning on closing or shutting their doors should be allowed to shut down during this pandemic. If they're going to go close later on, that's a decision to be made, but not during the pandemic. The state and federal government should step to the plate.
Keep the doors open, at least for now. The president has given himself high marks for his handling of this crisis. I believe he said it was a 10 out of 10. Your response to that?
That's not so, no. We cannot do it. There's no way the president can give himself or anyone else. We missed this thing. We've missed it by months. December, we can't say that. Worried about the stock market, it's not a big deal, this and that. You can't get high marks for that. I'm sorry, Mr. President. Let's basically work together. I'm not bashing people or blaming them, but my goodness, don't praise yourself when the job that we did and the job that's been done for our country is not adequate whatsoever. We wouldn't be in this massive meltdown right now if it was. We could have been on top of that curve, prevented it from escalating to the point it has.
Senator Manchin, thank you so much for your time. We appreciate you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.